everyone, my name's Caitlin, and I'm going to be discussing Native American healthcare. So, in Module 1, we went over how the Indian Removal Act was passed by Congress in 1830. But what we haven't discussed is the massive impact that Native American removal has had on their culture and healthcare in the last nearly 2 centuries. Throughout our history, Native American healthcare has been tied to the same concepts of standard healthcare as opposed to Native knowledge. Outside entities, such as the Bureau of Indian Affairs or the Indian Health Services, continue to manage Native healthcare and are only recently beginning to consider the cultural differences, as well as the generational trauma associated with differences in healthcare among Native populations. Some examples of how generational trauma impacts Native cultures also includes the prevalence of conditions such as alcoholism or other behavioral health disorders. Before we dive into the aspects of these conditions, it's necessary to point out that approximately 20% of Native Americans do not have health care coverage and make up 2% of the total population of the United States. Now, many of the conditions that are culturally found in tribal communities are not specifically annotated in the DSM manual, creating a discrepancy between care needed and care available through standard providers. With that, there are some resources that attempt to alleviate access for many Native families. Native American veterans have a higher rate of service in the military, despite only being widely known in such instances as their success as code talkers. This service entitles these Native veterans access to treatment at Veterans Affairs facilities. In the early 2000s, the Veterans Affairs Department and the Indian Health Service created a memorandum of understanding between each agency to work together to address the medical and behavioral health needs of veterans. Another resource that has attempted to make an impact on the availability of healthcare to Native cultures is the Affordable Care Act. However, the Affordable Care Act did not identify some of the issues that the transition between insurance-based and service-based care created. My intent is to describe the resources that have been created in the last 2 centuries, some of the friction points between cultures and government involvement, and what impact it has actually had on Native cultures. Thank you.